program is the Afia Morning Show, and like we did tell you, we're talking about World Neglected Tropical Diseases Day. And we have a very, very special guest in the studio, the medical advisor for Reddit Nigeria, Dr. Tony Meka. It's good to have you here this morning.
Thank you very much for having me.
Yes,
well done, dear.
One of the things I hear from this is there seems to be that the lack of information has created the vacuum. And as we know, nature abhors a vacuum, and immediately this lack of information has been filled with myth, as the correspondent said, and legend. How badly is this lack of proper information fighting against the, working against the fight to prevent the spread of neglected tropical diseases?
Okay, thank you. Just like you said, lack of proper information about neglected tropical diseases has been the main challenge in trying to combat them. As you can see, a lot of myths exist within our communities, especially the remote communities where these diseases occur, because neglected tropical diseases are regarded as diseases of poverty. And these people that are often affected are people who live below poverty line. So you'll find out that just like every other health information available at that level of the population is very, very low. So come to think of neglected tropical diseases that has grown so large to constitute a very large health burden to the world, you can imagine what the issues are. Now, what are supposed to be done and what are happening? A lot of effort is being geared towards information dissemination, especially to hard-to-reach communities. And these are being engineered by government and the partners that are supporting in activities to prevent and control and treat these diseases. And this, in the past, there was a kind of exclusion of the communities themselves, in efforts targeted at controlling, eliminating, and management of such diseases. Now, the effort is geared towards involvement of the communities themselves, because when you involve the communities, they see whatever effort that you are putting as their own. They will own the effort, they will participate in that, you train them, you inform them, and they will inform the rest of the community. And that way, you plan together with them and implement whatever interventions you intend to do. So that is what is really happening now through support of governments, then the partners, including WHO, and the other implementing partners we have in the country, including Reddit Nigeria, where I work.
So, Emmanuel, I'll let you go now, but I need to ask you this. Is there any plan, as Dr. Meka has said here, does the Abia State government have any plan to directly engage the communities in their fight against NTDs?
Of course, that plan is on, and that was why they had to call people. There are people now in the field. Apart from the fact that road awareness will be done today, being the World Day marking the neglected tropical diseases. So much awareness will be going on in the local communities to be able to tell them exactly. Like you heard the Permanent Secretary, Ministry of Health, said there that some medications will be administered, and the contribution made by Professor Etusim also was adopted, because a lot of collaborations needs to be done to be able to reach out to these people, because government alone cannot handle it, except with the help of these donor agencies that are coming around to be able to help. And it seems that the government is actually intentional about this time around, because it will no longer be centering is a survey on school children population, but by going into the hinterlands those who are out of school doing menial jobs, those who walk barefooted into streams and other swampy areas, and coming out to say that they have matched poison or one poison or the other, whereas what they are really suffering is exactly this set of diseases that are actually how would I put it at this moment? That just out there, out of poor hygiene.
All right, Emmanuel, thank you. I'll let you return to Mission Hill. Thank you so much for that report.
Don't worry, Mission Hill is in progress. Thank you very much.
All right, let me just come in, right? Dr. Meka, it's very important that we address one that seems to be endemic here in the southeast and the south-south, and that is the Buruli ulcer. That's something that many people do not know, or some may know about, perhaps professionals like yourself. Tell us about this prevalence and the risk factors.
Okay, Buruli ulcer, as the name is, I'll just give a little background, is one of the neglected tropical diseases, and it belongs to the family of neglected tropical diseases, NTDs, known as intensive disease management NTDs. You know, they're recently known as the case management in neglected tropical disease, because NTDs are broadly divided into two. Those ones that are amenable through mass administration of medicine or mass drug administration. So recently they become known as PC NTDs and preventive chemotherapy NTDs. That's what PC means. Then you have the other group that are more chronic in nature, and they require beyond mass administration of medicine, if at all. If at all there will be mass administration of medicine, it is at a particular phase of their development. But these ones, by the time they are fully developed, they require more than that. Then you have to manage them more actively, more intensively to get them treated. So Buruli ulcer, leprosy, advanced lymphatic filariasis are some of them in this group. So Buruli ulcer is one of them. Now, this Buruli ulcer, as the name implies, is named after a county in Uganda known as Buruli. And what we were told is that sometime in the 60s, a large number of people were found to have this disease in that county of Buruli in Uganda. And now the world decided to name it after that county to become, because it appears mostly as ulcers, but in the course of progression, it doesn't come on at onset as ulcer. It's usually a small growth, boil, or nodule, as we call it. So, but before then, in the 40s, this same disease has been found in significant numbers too around the Lake Victoria in Australia. That area is called Bensdale, but I don't know why we didn't name it Bensdale ulcer. We waited until we found it in Africa. That's by the way. So how does it present? It starts as a painless growth, small painless growth, usually on the skin. And most times it can occur in any part of the body, but most times you'll find them either on the lower limbs, like the legs and the arms. Now, who can be affected? People that are often affected are those who live in the riverines or near water bodies, or those who have to walk, or they have on daily basis their activities for living are conducted around riverine or wetlands. Excuse me. Now, when they have this disease, usually because it is painless, and our people, just like we were talking about that of information, lack of awareness, anything that doesn't give one pains, you say, okay, it will go. So, but it will gradually progress until it opens up to become an ulcer. And usually, once it opens up, other germs or organisms will now colonize the surface of the womb, and it now spreads faster due to presence of a toxin known as mycolactone. So it also usually affects children of school age more than any other population. Any person can get it, but you'll find it more in children under 15. So that's children in primary and secondary school, especially the early secondary school stages. So that is about the disease. And it is found in large numbers, or rather in the country. You of course, you know the riverines, you know the south-south, some part of southeast, then some part of middle belt bordering the, some states, some communities in Kogi bordering Edo State. These are where you'll find it. And you can equally find it in some part of Benue, bordering Cross River in the Ogoja axis. So these are the where you have the endemic communities. And since 2010, my organization, Red Aid, formerly known as German Leprosy and Tuberculosis Relief Association, has been in the forefront of trying to support Nigeria to combat this disease.
So, I mean, your motto this year is Unite, Act, Eliminate.
Yes.
To achieve this, I hear a lot about the work of donor agencies. I hear a lot about the work of non-governmental organizations. Yeah. You know, these are all part of the actions. In terms of the uniting, how, I know we saw, we heard from Abia State, but really, how effective in terms of creating, will I say, an enabling environment and offering the right assistance, like provision of use of primary healthcare centers and places like that, how effective have governments at all tiers, federal, state, and local, been in terms of providing support in the fight against the spread of NTDs?
Okay, thank you very much. Presently, I can say that there are so many donor agencies or implementing partners that are trying to support government in area of disease control, especially as it affects neglected tropical diseases. The primary role of government, you know, beyond providing some level of resources, is to coordinate these partners that are all trying to support government one way or the other in the fight against these NTDs. Now, because of course, we know that resources are going down, there is need for all partners to come together and coalesce whatever they have, coalesce resources, and they plan together so as to maximize the benefits of the efforts. Now, that has come to evolve a strategy known as integration. So government is supposed to be at the forefront of ensuring that this integration happens, because any partner that is working in any state or even in Nigeria or any local government is working not as a parallel agency, but buying into the government blueprint or government plan for management of these neglected tropical diseases. So the government has the right to tell every partner where they want them to work in. So that way, the government is expected to provide this leadership role in terms of coordination. Well, what I can say is that at all levels of government, national, state, and local government, this coordination is happening, but I think we need to do more because it is suboptimal.
So that's the unite and the act, the eliminate parts.
Yes.
In the purpose of fighting the disease, the two legs of elimination. One is taking on current cases, and B, preventing new cases.
Yes.
What mechanisms are in place? Because I mean, from what we've seen, a lot of them are found around, will I say, swampy, marshy, riverine places, usually remote and not densely populated enough that you can go to one area and have, like you said, mass
administration
of medicines.
Yeah.
Because people are spread out in remote hamlets and communities. So what mechanisms are on ground now? One leg now you are doing your fighting current cases. Prevention of new cases. How do you prevent new cases if these things come from the environment?
Okay, thank you very much. First of all, we have to start by having the right data. because part of the challenges we have in management of neglected tropical diseases is having the right data. Our data is not so good. But then, whatsoever it is, what is happening is that we have different levels of actors at different levels of the society. We have people at the policy level, both at the national and the state level. Then we have people operating at the implementation level, mainly at the state, local government, and ultimately the communities. And when we are talking about prevention, the prevention, it means you have to deal directly with the sufferers or at-risk community. And at-risk people are in at-risk communities. So within these communities, there are people, as far as NTD is concerned, that we call community implementers. These are usually members of the communities themselves who have been given some forms of training in some activities, including this mass administration of medicine, community sensitization and awareness creation, then referrals, and all of that. So what we do is that information takers, including commodity distribution takers, from the top down to the communities where these services are delivered. So I can say that a lot of effort has really gone into getting the communities to take ownership and ensure that all the government initiatives, including mass administration of medicine, which happens periodically, are implemented in all the nook and crannies of the affected communities. So, and maybe just before I go, I will let you know that, as of year 2021, when the World Health Day was proclaimed to take place on every 30th of January, it was discovered that over 1.62 billion people all over the world are affected, and 40% of them live in Africa. And of these 40% that live in Africa, Nigeria has a whooping share of about 25% of these. So the burden is very, very large in the country. But then the thing is that when you talk about neglected tropical diseases, if you want to talk about Southeast, we can only talk about those ones that are endemic here, because you'll find so many of them, some endemic in North, some endemic in South. Then even when you come to South, there are some that are endemic in Southeast, but you don't find them that much in Southwest and things like that. But I do not have the right figure in terms of number of people that are affected in Southeast. But one thing I know is that it is large, because some common neglected tropical diseases that we know are actually, like the Buruli ulcer you talk, the burden is very high, because virtually every state in the Southeast has a fair share of Buruli ulcer. Then leprosy too. Then because we now begin to talk of the preventive chemotherapy, NTDs.
So before I let you go, I have to ask this question. We've run out, but very clear to ask. A lot of these diseases and the ability for the infections to spread come from people having to go to places because they lack basic amenities, like pipe bomb water. People are going into swamps, access to electricity, access to good housing. In what way does your organization work with governments in policy formation to shine light on which areas need proper infrastructure as part of the, very important step in preventing new cases?
Okay, fine. You'll find the answer in what we do as an organization that supports Nigerian government in area of disease control. What do we do? First of all, we work, we do not have our own personal program. We work directly with government, partnering with the relevant government agency, mainly the tuberculosis, Buruli ulcer, and leprosy control program, as well as the NTDs division of ministries of health, both at the national and state level. And mainly we support the entire 11 states you have in the Southeast and South-South, and some states in the Southwest, especially with respect to Buruli ulcer. Now, we support them in areas of planning. We support them in areas of logistics. We support them in areas of supportive supervision. We support them in training and operational research. So, and all these things are components of strategies that are required to combat these diseases, both new and existing cases.
Thank you very much, sir. Thank you so much for being here this morning. Dr. Tony Meka, medical advisor at Radiate Nigeria, and of course, everybody has to do their bit to help in the fight against neglected tropical diseases, and we hope that everybody gets involved. The Afia Morning Show, we'll be right back.